Yeah, can you describe a little bit about the living conditions that you were in, and maybe a little bit about the clinic or your working environment? Maybe just try to take us in there with you as far as describing that for us.
Yeah, I think what's often surprising and maybe what people don't know, because I wasn't really familiar with, is that a lot of expats or expatriates who go and work for NGOs or UN agencies or who live abroad, live very well, almost like uncomfortably well. And like I had, a house. Here I was coming from college. I lived in dorms my whole life, and then suddenly I had a house in Harare and like a two-car garage. And, there were people who would clean the house for me and would cook for me, and it was very, very uncomfortable. Like I didn't know how to deal with that kind of circumstance for myself because I was like living in luxury. But then I would go to the clinic, and it was in a sort of surrounding semi-urban area called Chitanguiza, and it was about 30 minutes outside Harare. And I go there, and it's like a high-density suburb, almost like a South African township, but without the same real racial connotation. But nonetheless, just very, very poor people living, 20 or so people in one small house room, and just, not having barely anything, and, wandering around dirt roads and just very unclean, and, just the living conditions in and of themselves were just so traumatic to see, especially coming from my own home that I was living at that time with these giant walls and barbed wire fencing and, beautiful lush garden. And so it was really a total kind of have and have nots contrast, I think, being put into that circumstance and being put in that situation. But at the same time, just such a sort of enlightening experience to kind of go to these clinics and meet these people who were just unbelievable and willing to, really work with me and welcome me and really help me kind of understand what was going on and let me do anything that I could to help out.
So what were your responsibilities in the clinic there? Seeing people or drawing blood or, what kind of stuff were you doing at the clinic there?
So initially I had gone to try and sort of further develop the research project that I had been working on at Stanford, where we were collecting the blood samples and looking at the virus, and we wanted to go there and actually do more kind of on-the-ground follow-up, looking at how the virus was mutating based on the drug regimens that the patients were on, because the government had recently started like a Ministry of Health antiretroviral rollout where generic medications were being available at very low, if not free cost for patients. And we wanted to see, with the transitions of medicines that people were on, how well they were doing based on resistance profiles. But the equipment that we wanted to use for that actually couldn't, we couldn't bring it into the country and couldn't use it. And so when I was at the clinics, I was doing a lot more shadowing. I was doing a lot more kind of like basic organizational things. I tried to get computers donated from the UK so that we could have some form of sort of database collection and try and sort of profile patients in terms of their demographics. But what ended up happening was, I found myself pretty much there in Zimbabwe 1 month in, and all the projects I had kind of designed to go there couldn't happen without this equipment and without the technology and everything that I needed. So I ended up meeting an amazing friend and colleague and physician at Elizabeth Glaser, who kind of took me in and told me about the projects they were doing in the same community, one of which was sort of trying to work on stigma revolving around mother-to-child transmission of HIV. And she kind of brought me into the fold, and we kind of discussed and threw ideas around as to what we could do to really help with this issue, and sort of came up with the idea of, working to develop a video, sort of documentary of this HIV-positive drama group who was performing all these skits around the community, kind of at the various clinics about their own personal experience of living with HIV, to try and kind of normalize that and bring that into the limelight. And we really just wanted to find a way to capture that on film in a way to kind of design a kind of discussion forum that we could then bring around to different parts of the country with this video.
Can you describe a little bit about what was the attitude, what was the stigma that you had to deal with, in the country there, or where you were at?
So it was a lot of unfortunately, the women were getting the brunt of the blame and a brunt of the lack of options when it came to protection, it came to prevention of transmission, and also being blamed if they were infected by their partner. The partner would blame it on them, and they would find themselves pregnant and then kicked out of the home with nowhere to go, even though more often than not the male partner was having extramarital affairs with other partners and actually was the one bringing the virus into the home. So the film really was a sort of female empowerment almost, kind of showing this very specific example of one woman sort of talking with the rest of her extended family, aunts, and uncles and everyone else that she could sort of gather up after being kicked out of her home by her husband because she found out she was HIV positive at the clinic. And so it was sort of trying to document that and sort of bring that out and show that, the clinics in Chitungwiza and in that area did offer testing, counseling, confidentiality, and medications to prevent the transmission during the birth of the child, but sort of taking it through the kind of, this specific example to kind of really highlight how that would go, how people would go about that in the community and try and keep it confidential and safe at the same time.
So how did you put the video together then? You just shot video of different types of skits, or how was that put together?
So the HIV, the drama group that we worked with, it was the Zimbabwe AIDS Prevention Project, or ZAP drama group. They had the whole skit that they had been performing for months before we actually, approached them with this idea. And it was just a matter of, actually scripting it and filming it in different scenes, because they were performing it like a play outside the clinics, but we wanted to sort of make it more like a 30-minute TV show. So we wanted to take it into different scenes in the homes, at the clinic. We wanted to set up and show what an actual counseling session would look like with one of the HIV counselors. We wanted to show the delivery room. We wanted to show the medications and how they were administered, really kind of trying to realistically demystify the whole process so that people would feel comfortable approaching the clinics, coming forward, and really knowing what to expect. So we kind of would travel around all the different parts of Chitungwiza in these homes and clinics and wards and really filming the different skits teased out of the play that they had already scripted and been performing.
Okay. You described that this Zimbabwe experience really solidified your decision to go into medicine. Do you recall kind of a moment where it really solidified it for you, or was it just kind of the whole experience in total when you were there, or when you were coming back, or have you really kind of narrowed it down? I'm just kind of curious about something like that.
Yeah, I think that there was a specific patient, I think, that really brought me to realize that I wanted to be a doctor, and that the experience had sort of shown me the massive public health interest and possible media interest that I had with health through the video project. But there's this patient, Joseph, who I had worked a lot with and was a member of the HIV positive drama group. And, he just, more than anyone else I had met, kind of welcomed me into his life and was really kind of my tour guide of Chitungwiza before we actually started working together. He also volunteered at the clinic and was trained as a counselor. And, meeting his family and going into his home and having him open up and share about his struggle with HIV, his sickness, what it's done to his family, that kind of one-on-one personal medical interaction really showed me that I did want to go to medical school to become the doctor so that I could still have those one-on-one, really patient-physician interactions that you can only get with this training, rather than just have more of the public health focus, which I think you can do both and combine both, but to have that one-on-one relationship that you build with the patient, I think is something truly exceptional that was really solidified by my experience with Joseph.